Joyce. She's the manager, the billing manager, right? Insurance billing manager for Push. She's going to talk to us about the insurance. So I thought this would be a really good opportunity at the beginning of the year to get some basic background on our insurance policy, as well as some common mistakes that graduate students might make. And so she's going to give about a 10-minute presentation, and we'll open it up for questions about 5 minutes afterwards. And so I think this is really good because you can take this information back to your constituents when they have questions about the insurance issue. So Joyce, please.
Great. Well, please keep on eating. I love the distraction. So I'm just going to go and give you a few little things that I want you to all be aware of. Maybe some of you are new to Purdue anyway, as far as the Student Health Center goes. And when you are full-time students, you do have free office visits at the Student Health Center in our medical clinic, Monday through Friday. You have unlimited nutrition consultations with our registered dietitian. You have a lot of resources from our health education department. Free flu shots, something to keep in mind as we approach October, probably when we'll be getting flu vaccine. Through the Work Life program, you and any spouse can get free flu shots. There's also psychological and counseling services at the Student Health Center, and there are limited consultations, I think about 6 per semester, that are available free. Just so you all know, if many of you have never visited us before, we are a full facility, and there's allergies, laboratory, radiology, physical therapy, sports medicine, urgent care, all kinds of services, and this is covered under your student health insurance policy. Our medical clinic hours, just so you know, Monday through Friday, 8:30 to 4:30. Urgent care is open on weekends, 10 to 6. And it's also open in the evenings until 8. Now, the health insurance plans, there are 3 for graduate students. Probably a large amount are going to fall into the graduate staff plan or the fellowship plan. To be benefit eligible as a graduate assistant, you have to be half-time or more. So a quarter-time appointment would not qualify you. Fellowship students are actually it's the same plan technically, but it is kind of geared, it's named the fellowship plan. There's a different enrollment process. And then all other graduate students would either fall under the international plan or the domestic plan. The only students that it is mandatory for at this time is the international student population. And you would have your choice if you qualify for a grad or fellowship plan, or if you just want the international plan. I wanted to highlight just for some changes, so some of you that may have been on the plan last year, you know what the changes are. The copay has changed from $10 to $15 this year. It is the first increase. I've been at the Student Health Center 6 years, and it's the first time it's increased, and I think it's even been possibly longer than that. There is an emergency emergency room copay this year, which is $75. That's a little bit different. Last year there was a copay. Well, you would have your $10 copay if push was closed, and then you had to go to the emergency room. Then you only had a $10 copay. But if you went anytime when push was open, then it applied to your deductible, and which was $350 for an in-network provider at the time. This year, it's $75 independent of whether push is open or closed. And so if you had an emergency situation where you really needed to go to an emergency room, it'll just be at $75, the deductible is waived. So it's kind of a plus and a minus. But actually, emergency rooms really run very expensive, so a $75 copay is probably a really very good deal. The network has changed a little bit from Options PPO Plus to Choice Plus network, and I've been told that it is a network that's even a little better this year. It includes more providers, though most of the providers, doctors in the Lafayette community were in the PPO network, and they're also in this Choice Plus network. The deductible has changed a small amount. The in-network deductible went from $350 to $400. The out-of-network deductible has stayed the same at $700. Preventive care, this is something very important for you all to know, is that preventive care, there's a $500 allowance on the policies. However, that's per year, but you need to have that done at push. So any physical exams, blood tests that you need for screening for cholesterol or blood sugar or diabetes or whatever should be done at the student health center. It's just for screening purposes only. Gardasil shots for women need to be done at the student health center. The insurance office is in actually room 338 and 340. We've expanded to 2 rooms this year. We have 2 staff representatives that they can assist with claim questions. Believe me, I think they have become best friends with the many students here on campus, as they are very, very helpful, can save you money when you're getting claims from other facilities. Mostly it's the hospitals or other doctors that people run into problem with, not so much with push. But if you have questions about continuation enrollment, or just basically, does my insurance cover this, that's a good place to go. Plus, we went green this year, and the brochures were not given out to you in your packets. They are available online at our website, or if you want the actual printed brochure, they're available upon request at our insurance office. But we really tried to save money and save paper, since we'd heard from, I told the Purdue Graduate Student Government team, including Andy, and they really felt that a lot of those just got wasted and thrown away, and people were accessing them online anyway. Replacement cards, claim status policy, you can either go online and get that log into your account and ask for replacement cards. You can also call the direct number that's also in your brochure information online and request those. There's a collegiate assistance program. That's where you have 24/7 access to nurse hotline. So if it's the middle of the night and you need some health information, if I'm really concerned about whether I need to get to an emergency room or wait for the doctor in the morning, if you're kind of really wondering, you can call that number for support. Continuation insurance, this is something I want you to be aware of as well. Any student who has been on the insurance plan for 6 months is eligible for a continuation plan up to 18 months. So if you graduate or no longer have an assistantship, if you've been on it for 6 months, you can continue to get health insurance, this plan, for 18 months. But you have to enroll within 60 days of notification. Usually a letter is sent out to you notifying you that you are eligible. Any enrollment or payroll questions need to be directed to staff benefits, as they are really the ones who handle the enrollment for you. Today is the deadline, September 8th, and so if you have not enrolled yet, you have until midnight, I believe, to get online and do your enrollment. Even if you were on it last year, every student who wants it needs to enroll again. It is payroll deducted for grad staff. International students who aren't on an assistantship or domestic students can pay online with a credit card. And fellowship students, hopefully you have all made it over to the Student Health Center, because that is where you had to enroll for that. Dental enrollment, that's often a question that's asked. That is not part of the medical health insurance plan. That, again, that is handled through staff benefits. And that is when the regular staff and faculty have their open enrollment, which is around October period. And you should be getting information from your business offices if you're interested in the dental health insurance plan. Vision coverage is automatic. If you're on the Purdue graduate staff health insurance plan and you have enrolled your dependents, then all of you are covered under the VSP I vision plan. Those who opt out or only enroll themselves on the health insurance plan, they only have automatic coverage for themselves. Fellowship students and those who aren't on the grad staff plan, fellowships have to enroll separately. Any other undergraduate or graduate student that isn't on the grad staff plan would not have vision coverage. I would encourage you also to review your paycheck to make sure that your deductions are coming out for your health insurance if you are on a grad assistantship, as sometimes things happen and it's your responsibility to make sure that you have been getting that taken out. Again, if you have any questions, that's a staff benefits issue. grad staff appointment terminations. This is, again, something if you would happen to be terminated and you're on an academic year appointment, that means you're getting paychecks basically September through August, or September through April, I'm sorry. If you're here through April, your insurance is paid up then through August 5th of next year. But if you're on a fiscal year appointment where you get paychecks every month for 12 months, your business offices can tell you that, and you lose your assistantship, your insurance is terminated on the 5th of the month after you are terminated. And you would need to contact the insurance office as soon as possible to get continuation coverage. So that's really, if you happen to lose your appointment on assistantship, something that's very important to note is if your fiscal year or academic year, how you're paid. Your business office can tell you that because we will need that information in order to sell you continuation or to even see if you need it, and you might not. Another important thing, if you're on an assistantship and you're going to a fellowship, it's really important to talk with the student insurance office so that you don't have a lapse in coverage. I know I'm really covering a lot of information here, and I can actually get this information to you in a form of this PowerPoint presentation. We can post it on a website if that would be helpful. Okay, we can do that. Making changes in policy coverage. If any of you get married, have children, you had insurance through a parent, but then your age has kicked you off, or your parents lose a job, you can get insurance through the health center if you haven't, or through the university, but it has to be within 31 days of the event occurring. So don't wait on that. Really look into that situation as well. Our website, purdue.edu/push. I have a whole tab on student insurance, specifically things on grad, staff, fellowship insurance, internationals, domestics, all kinds of things that are on here. So, and frequently asked questions, please utilize that, but contact us. I think I'm going to just kind of stop there.